Despite the availability of COVID-19 vaccines to all South African adults, the rate of inoculation still remains low, with just 20% of adults having received a first dose. With South Africa's COVID-19 death toll surpassing 79,000, the volunteer health workers are struggling to address people's vaccine fears. All South African adults can now officially get inoculated with COVID-19 vaccinations. However, it is still a huge task for the government to convince its citizens that COVID-19 jabs are safe. This is after the government's reiteration that taking the jab remains voluntary. The country's fight against the coronavirus pandemic is no longer hampered by a short supply of the vaccine. According to a report released by the Centre for Social Change at the University of Johannesburg, it is rather the under-demand or the low demand for the vaccine that is of concern in the country.
The findings also point to particular groups that are not as accepting of a COVID-19 vaccine, and these are young people in particular, those aged between 18 and 34, where their rates of vaccine acceptance are only 55%, and also amongst white adults who have a similar rate of acceptance of 56%. So this highlights that although overall most adults are willing to take a COVID-19 vaccine, that there are particular groups that we are concerned about.
South Africa has vaccinated a little over 10.5 million people so far. Out of this, 4.83 million people have been fully vaccinated. The government's aim is to have 35 million people jabbed by Christmas. Even though young people between the age of 18 to 35 years have registered in large numbers to get their vaccine, the big question still remains on whether government will meet its target. This is Colin Olmo from Johannesburg, South Africa, for WION World is One.
WION World is One is now available in your country. Download the app now and get all the news updates on the move.